With conventional radiotherapy, which is improving all the time, there's a recognized incidence of damage with radiation to the bowel behind the prostate, i.e. largely the rectum. Hello, I'm Raj Persad, a professor of urology in Bristol, where I've been a consultant for roughly 28 years, but I also work in South Wales, in Bath and in London. Today I'd like to talk to you about the procedure of SpaceOAR Hydrogel Insertion. That's quite a mouthful, but essentially what it is the placement of an absorbable hydrogel between the prostate and the rectum as a very useful adjunct to radiotherapy. Let me explain further. Radiation therapy to the prostate is a very effective treatment, and the aim is to destroy all the cancer cells within the prostate without damaging or disturbing any of the tissue around it. With conventional radiotherapy, which is improving all the time, there's a recognized incidence of damage with radiation to the bowel behind the prostate, i.e. largely the rectum. The side effects after radiotherapy, despite having cured the prostate cancer itself, can be frequency of bowel habit up to 5 times a day or more, loose stools, inflammatory pain in the rectum, mucus discharge, rectal bleeding, and urgency and frequency of bowel movement. So the people who invented this coined the phrase, a little space can make a big difference. So effectively we are just injecting 10 mils of this hydrogel to increase the space between the rectum and the prostate. As part of radiation therapy, the oncologist may also have treated the patient with agents which shrink the prostate to make it a more targetable area without scatter of radiation to other tissues. So that in itself is an advancement. But in addition to that, if you use the SpaceOAR, it can reduce side effects even further. Now, the beauty of this SpaceOAR is that firstly, it is absorbable so that it's placed in the right space under anesthetic by the urologist or the oncologist, injecting it, critically targeting this space between the rectum and the prostate. And it survives there, or it lasts there for 3 months, during which radiation planning and radiation treatment can take place. And then it dissolves. The more advanced OAR is called the OAR view, and the added advantage of that is that it is radio opaque and can be used in planning on CT scanning, so that the oncologist can do exactly the type of conformation to the prostate for radiotherapy to have optimum effect. So, in summary, the SpaceOAR is a modern development. It's been used in over 10,000 cases in Europe, and it is designed to avoid or reduce side effects from radiation, particularly with regard to rectal toxicity. The procedure itself takes possibly about half an hour, including preparation and planning, and it is a very low-risk procedure. This is something I would recommend for patients going forward for effective radiotherapy treatment for prostate cancer, making it even more effective and causing less side effects that could remain with the patients for many years to come, if not avoided. Thank you for listening.